Hello, everybody. My name is Joshua Lozeau, and today I'm going to be going over autism. So, what is autism? Well, autism is classified as a neurobehavioral spectrum disorder. Well, what does this mean? This means that autism is going to affect your brain, and by affecting your brain, it's going to affect your behavior because your brain kind of determines your behavior. What does it mean when it's a spectrum disorder? Well, a spectrum disorder is something where there is no single cause for the problem. There's no single cause for the disorder. Instead, it is affected by many different things. It could be the way the person grows up. It could be physical conditions like, oh, I got hit hard, or it could be something like your genetics. And so when you see a person with autism, you can see a change in their personality in three different categories, that being their social interaction, the way they communicate, and their behavior. And so a person who acts with autism may show that they are avoiding eye contact. They have they might have difficulty reading your emotions or displaying their own facial emotions. They could have inappropriate body posture in different contexts. They might be in an interview, and while they're supposed to have a very serious and like formal body posture, body language, they might be displaying subconsciously displaying that they are relaxed and they don't care. They can have a lack of reciprocity. Reciprocity is a idea of give and take. And so if I give someone my book and I expect to have it back, they might not understand that mentality. And so they just keep the book. Normally with people with autism will have a higher priority in self-interests. And so they will have a lower interest in group activities. They might prioritize themselves over the group. And two different things that people with autism have when they're babies is they may not react to peekaboo at all. And they might not be comforted by touch. And so if I'm a father and play peekaboo with my baby, and they're not reacting to peekaboo, they're not reacting to peekaboo at all, then that could be, oh, this person, my son might have autism. Or a mom goes to the baby to hug him because the baby looks uncomfortable. Well, consistently, if that baby is not being comforted by our touch, by anyone's touch at all, that could be a sign that, hey, this kid might have autism. Another area is communication. So in communication, um, the signs of autism could be shown right off the bat or in developmental stages of communication. So if the person with autism is mute, as in they never talk at all, that could be a sign. Another thing is when they turn like 10 years old or later on in life, they just abruptly stop talking and they don't talk again. That's another sign. Or, okay, let's say that they talk. Let's say that they are able to talk to you. Things that you could see is that they might have difficulty taking turns in conversation. And so you're telling them a story, and they keep on cutting you off. That could be a sign that they may have autism. Another thing is echolalia. And so I'll give you an example of what echolalia is. Echolalia is saying, "Hi, how are you doing?" And the person responds with doing. Now, that doesn't make any sense, but they're echoing what I'm saying. That's what echolalia is. They're echoing what you're saying, even though it doesn't really make sense all the time. Difficulty taking perspective of the listener. And so that's an issue with empathy. And so you are telling a person, well, here's how my day was. I had a rough day. Well, the person with autism may not understand how you feel, and so they may not they might not match your tone and match the way you feel. Other areas of communication that are affected in people with autism are responding to humor and understanding innuendo. So innuendo is hints and subtle phrases in order to help you like understand what they mean. And then there's also humor. And so in those areas, normally people with autism are going to take you seriously. They're going to take you literally when you're talking to them. And so if I were to give them a joke, I said, my dog is a mop. That my dog literally isn't a mop, but my dog looks like a mop. That might be like, your dog is a mop. They might take you seriously by that. Or if you're getting innuendo, you're giving them subtle phrases that indicate something. They may not understand what you're saying. They might go over their head. And then behavior. So if you're looking at a person with autism from afar, you can see a couple different things. They might be fidgeting with toys. They might be rocking back and forth or flapping their arms and legs. Now, rocking back and forth or fidgeting with toys, that doesn't mean that, hey, you have autism, but it could be a sign if they're doing that more than normal. If they're doing that in a way that's like, oh, this person is doing it a lot more than normal. That could be a sign that this person might have autism. Another area is a necessity to feel for a similar environment. So if you take a person with autism outside of their home into a place they've never seen before, they might feel really uncomfortable. They have a necessity to be in an environment that they feel familiar in. And then there are their senses. So hypersensitivity and lack of awareness. Let's talk about your sensory senses, like your gustation, your taste, your hearing, your smelling. Person with autism, they say you smell something really bad, something really foul. If they're hypersensitive in their smelling senses, they can smell that what you're smelling, but 10 times worse. Or they may not have awareness to it all, a lack of awareness to the smell. Another area of lack of awareness is they are doing something right now. They're fidgeting with a toy and you're calling for them. They hear you. Hey, I need you to come over here. Well, they hear you, but they're busy with their toy and they just don't really respond. They may understand you and may hear you, but they just lack the awareness to get up and be like, "Oh, I'm coming over to help you out." Now we talked a lot about the signs of autism, the symptoms of autism that could be pretty bad. But there's one thing that's good about autism that some people with autism have. It's Savant Syndrome. Savant Syndrome is this condition where a person is going to be really, really good at one thing. They may have a lot easier time at learning music, math. They may have a lot easier time at learning science. But usually people with Savant syndrome tend to will be really good at one thing, but they tend to lack in other areas. Like, I'm maybe really good at playing the piano, but I'm not that good at listening to people, at talking to people. I might not be that good at doing my finances. Other causes of causes of autism are either genetics or environment. So now when I say causes of autism, there's no singular root cause of autism. Genetics and environment play into it, but they don't like cause it. There's no one single gene that says you're gonna have autism, or the environment is gonna make you have 100% chance of having autism. Instead, these areas play into it. And so in genetics is mainly seen as like a huge factor of why autism happens. Because if you look at the statistics, boys are 4 to 5 times more likely than females to get autism, and boys will have a different genetic structure. They have different sex chromosomes. While boys have XY chromosomes, females have XX chromosomes, and so they are built differently genetically. So seeing this statistically significant factor of 4 to 5 times more likely, then it kind of shows that hey, genetics are a big impact on autism. But not only that, if you look at twin studies, twins, like say, here's one twin over here, one twin, his name is John, and his twin brother is Jacob. Well, John has autism, and because John has autism, I assume from statistics, Jacob has an 80% chance to have autism as well. And this is pretty significant, saying that, okay, well, they have a similar genetic structure. But because they have a similar genetic structure, his twin brother is going to have an 80% chance of having autism. Now, the environment also plays a big role in autism. If you look at cities with a lot of jobs in information technology sectors where they're working with computers a lot, they have 2 times higher rate of autism, and this makes sense because if you look at the signs of autism, how people with autism present, you can see that they have a lot of social and communication issues, and so this makes sense in the information technology sectors because if if people are working on the computers a lot and not working with people that much, then it makes sense that they're more likely to have autism. And then there's pregnancy period. So the way that children are treated or that babies are treated during pregnancy indirectly affects whether or not they will have autism. And so, as known widely, is that moms who smoke and moms who are exposed to dangerous chemicals like pollution are they give their babies a susceptible chance to have neurodevelopmental issues. Their babies more will have a higher likelihood of having issues with the brain. And so um, this plays in context into like conditions like depression, epilepsy, and ADHD because if if the moms who smoke and are exposed to different dangerous chemicals um, give their babies a higher chance of having these kind of conditions. Well, looking at it, 70% of autistics have these kind of conditions. They have conditions like depression, epilepsy, and ADHD, these core current conditions. And so when medical providers look at this, they're going to use a clinical investigation, aka a series of tests over time to identify whether or not someone has autism. They're going to use these tests to identify risk factors, like if the kids will have autism, like if the kids will have co-occurring conditions in order to play into the statistics to see if, okay, I'm going to use all these different things to say, okay, you have this current condition, or you live in a city with a lot of information technology, or you're a boy. I'm going to use these different factors to say, okay, this person might have a high likelihood of autism. Okay, so because this person has a high likelihood of autism, I'm going to use more tests on them. I'm going to use an MRI. I'm going to use a magnetoencephalography. What an MRI is this test that this machine that looks at your brain to see what it looks like. And as seen in studies, people with autism at 6 to 24 months old will have an enlarged amygdala. It's a part of your brain that's responsible for memory and emotion. And they'll also have neuroinflammation, aka inflammation in their brain. Not only that, but later on in the life, they could have an enlarged prefrontal cortex as part of their brain. And that part of the brain is responsible for logic. And so these are big signs that, hey, this person really might have autism. And then there's magnetoencephalography. What this is it tests the electrical impulses in your brain, aka what parts of your brain are being used at a given time. So not only people with autism are gonna have like more local impulses. And so while you would probably be using this part of your brain, this part of your brain, this part of your brain, and this part of your brain to solve a problem, the person with autism will tend to just use this part of the brain a lot more often. And this could explain why a person might have Savant syndrome because they tend to be using this part of the brain a lot more rather than the rest of the brain. Now, as the medical providers diagnose a person with autism, they will usually group it into two different categories: Asperger syndrome or Kanner syndrome, and these are based on severity. And so a person with Asperger syndrome is called a high functioning autistic, while a Kanner syndrome will be a low functioning autistic. And so a high functioning autistic is a person who could live independently. They can live on themselves and not have to worry a whole lot about treatments because the symptoms that they have with autism aren't affecting them so bad that they can't really live a more normal life. But with a person with Kanner syndrome, they need to have a lot more resources such as a caregiver or medications that might tailor to their co-occurring conditions, or they might have coaching. And so if a person with autism may not understand empathy, then they have coaching sessions to help them like improve upon their empathetic skills. And then they'll also, having autism, like having Savant syndrome in autism is, a big opportunity. And so what coaches will do is they'll build upon their strengths. If you're really good at math, they will give you a math tutor. We're going to give you a lot of resources to help you build upon your strength, but you're also going to give you resources to make sure that you're not really bad at everything else. But that is my presentation. I hope you like it. Thank you for letting me do this on the presentation.